My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So it's very common for patients to come and see me requesting very specific things, a very specific surgery or a very specific change to their nose that they probably don't need, or that isn't actually going to look good on them. One of the common ones is that people will come and say, I don't want an external rhinoplasty. First of all, I often find that patients don't really know what that is. They've just read that external is invasive, or it produces terrible scars or whatever. And that's just marketing. It's the difference between an external and an internal rhinoplasty in terms of the amount of scarring, the amount of swelling is really minimal. So I think that the approach to the inside of the nose that's taken for a particular patient really should be determined by what types of changes they need with their rhinoplasty. I don't think it's really all that helpful for a patient to say, I want a closed rhinoplasty versus I want an open rhinoplasty. It's like asking me to use a knife and not a pair of scissors when I'm cutting something. I think it's probably best for me to decide what technique is going to be the safest and what's going to be the most effective. So I hear that quite often. And once I've sort of explained the difference between the different surgical approaches, people usually go with what I recommend. Like I said, some people request or specifically want a closed rhinoplasty. They don't usually understand what that is, but they've read or heard that it's better. I think if somebody has a tip abnormality, for example, their tip is tilting downwards and it needs to be lifted up, as long as they have a straight septum, their lateral cartilages are not particularly curved. If they really have a very simple, straightforward rotation of the tip required, sure, that can be done closed. That's very uncommon. Most people have asymmetric tip cartilages. They're often a little bit too wide. They need to be narrowed a little bit to make the nose look a bit more refined. These are all things that are very difficult to do with a closed approach, and often you compromise the result by trying to do it closed because it's the patient's request. I think it's always best for me to recommend what's going to give the best final result. And then if someone is willing to make a compromise and say, well, I don't mind maybe not getting as good a result because I really want to use the closed approach for some reason, well, that's up to them, and that's something that I would certainly consider, but I think that's pretty uncommon. The mindset of patients when they're asking for a closed approach is that they are told, or they've read, that the scars are going to be much less if it's closed, that they'll have less swelling if it's closed, and that's not true. I think that the amount of swelling after an external rhinoplasty is no different than a closed rhinoplasty. The small little scar that is required with a skin incision for an open rhinoplasty will become invisible with time. I mean, it's not something that people notice. I find it hard to see the scars in the postoperative period when I examine patients. It's really a non-issue. The main reason to consider an external approach is if you have lots of very specific, very particular, very refined maneuvers that need to be performed on the nasal tip. You can do these much more predictably with an open approach. So I don't often see a patient that is going to get a better result with a closed approach, but if I do, then I will use that. So often patients will come in and say, look, I want to have a rhinoplasty, but I don't want you to break my nose. That I could also do your surgery with one arm tied behind my back as well, if you request that. But that's preventing me from achieving the results that most people really want to have. If you have a big hump, you need to have osteotomies, because you take the hump off and you're going to have a hollow, open roof in your nose, and your skin is going to suck into there. That would be a disaster. So unless you have a very, very small bump that can just very, very gently be shaved down, in 100% of cases, you need to have osteotomies. Those nose bones need to be brought back together because the nose is hollow. If you take the hump down, there's a space there, and not only will your nose look very flat, but eventually the skin will grow down into the hole and you'll have a big defect there. The osteotomies are definitely going to cause bruising and swelling that you wouldn't have if you didn't do them. But if you have a hump on your nose that needs to be reduced, then you know it has to be done. There's no way to bring the nose bones back together appropriately without breaking the nose bones. So again, you know, the term break is not particularly elegant. Really what we're doing is we're very precisely making cuts in the nose bones so that the nose bones can be moved to where they need to be to give you a good aesthetic result. And yes, moving those nose bones does cause bruising, and it probably contributes to swelling, but that bruising and swelling is gone after 8 to 10 days. And I think if you know, in the long run, at the three week mark, for example, you're not going to have more bruising or swelling if you did the osteotomies, but you're going to have a much nicer nose. And I think the goal is for your nose to look good for your whole life, not to come out of the surgery with no bruises. So the other worrisome request that I sometimes see is a patient who wants a very dramatic change to the shape of their nose. They may have a small hump, but they want, or even a large hump, and want to have a vast majority of it taken away and have a very small nose. Or someone who wants their tip tilted dramatically upward to a point that probably is beyond you know, sort of aesthetic norms. That always worries me a little bit. And I think in general, although they might think it's a good idea, it probably isn't. I think when you rearrange the nasal anatomy that much, chances are it's going to cause some unusual aesthetic result in another part of the body. They may see their lip too much. Eyes may look too far apart if you narrow the nose too much. I think there's some definite cosmetic risks with making dramatic changes to the nose, not to mention functional risks. If you're making a nose extremely narrow, or if you're taking a very large hump off, I think there can certainly be some physiologic problems as a result of that. So if you're thinking about making changes to your nose, the most important thing is to have a quality consult with someone who does a lot of rhinoplasty, and you've got to do computer imaging so that you know what to expect from your result. Also, you need to be able to trust that the surgeon can predict what your nose is going to look like with surgery.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.